Our case study patient presented as a 29-year-old female with cerebral palsy. Her presumptive diagnosis is systemic diseases or conditions affecting periodontal supporting structures. She has frequent dental visits every 6 months. Her medications include glycopyrrolate and bafidin pump. She presents with sensitivity to cold and does have a history of caries. She has noticed that her gums are swollen and tender, and some are receded. She does drink sweet tea 2 to 3 times weekly, and she presents with localized 4 to 5 millimeter pockets. This video will explain the aspects of treatment and dental considerations for a patient with cerebral palsy. Prior to the appointment, you would want to obtain and review the patient's medical history. Consultation with physicians, family, and caregivers is essential to assembling an accurate medical history, and you would also want to determine who can legally provide informed consent for treatment. When seating a patient with cerebral palsy, you would want to maintain clear paths for movement throughout the treatment setting. You would also want to keep instruments and equipment out of the patient's way. Some patients cannot be moved into the dental chair and must be treated in their wheelchairs, so you must keep that in mind. And if you do need to transfer a patient from a wheelchair to a dental chair, you need to ask the caregiver or the parent about special preferences, such as padding and pillows or other things that you can provide to ease the transition. You may want to keep in mind that there are some conditions such as seizures, visual impairments, hearing loss and deafness, dysarthria, and GERD that accompany cerebral palsy.
If you're treating a patient with cerebral palsy in the clinic, it would be a good idea to make different accommodations for the directions to get here. Just because at the Virginia Western campus there's a lot of stairs involved in getting here, so using an elevator or just coming directly into the clinic would be better than having them go all over campus trying to find a way to get in. If the patient uses a walker or just has an unsteady gait, you might want to ask them if they would like to take your arm, just so that they're more stable and steady on the way to the clinic.
Providing oral care for people with cerebral palsy can be difficult because they do have some uncontrolled body movements. Individuals with cerebral palsy can have exaggerated responses to loud noises or certain stimulations like the slide rejector. You just want to make sure you demonstrate those things to them so they know what to expect and they're not going to be startled by it. Now you want to give your patient with cerebral palsy some tinted glasses so that your loops or your overhead light don't startle them and cause an exaggerated reaction. Many people with cerebral palsy do have a mild or moderate form of intellectual disability. Only around 25% have a severe form. Patients with cerebral palsy may have difficulty brushing their teeth properly, so it may be better for them to use an electric toothbrush if possible, but if not, you may want to make some adjustments to their manual toothbrush to make it have a wider handle so they can easily grip it, or you can also encourage their caregiver or family member to brush their teeth for them, making sure they know the proper sulcular brushing technique.
Since patients with cerebral palsy are at higher risk for falls, you would want to look out on the oral exam for any kind of injuries that might have occurred if a patient had fallen recently.
For the patient with cerebral palsy, you may need to cradle their head while working on them like this, just to make sure that they're not going to jerk their head around or you're going to injure them with an instrument. It's common for people with cerebral palsy to have a hyperactive gag reflex or a hyperactive bite reflex, and so you may want to use a bite block. The important thing with cerebral palsy, I would think, would be just making sure that their caregiver or their parent is brushing their teeth at least 2 times a day for at least 2 minutes and flossing once daily, and keeping a consistent schedule with that. Also, a mouth rinse with fluoride is always a good idea if the patient is able to use or swish it around without swallowing it. Patients want to make sure that they're keeping up with their dental visits, and they would probably be on a short recall, maybe 3 months. Lastly, you always want to record in the patient's chart strategies that were successful in providing care. You also want to note your patient's preferences and other unique details that will help facilitate treatment, such as music, comfort items, and flavor choices.